What if the greatest threat to your independence after the age of 70 is not a major illness, but one ordinary step that your body is no longer prepared to correct? A foot catches the edge of a rug. You turn too quickly in the kitchen. You step off a curb and the ground is slightly lower than expected. For a brief second, your body moves outside its safe center. When we are younger, the feet, ankles, hips, eyes, inner ear, and nervous system usually respond so quickly that we barely notice what happened. The body adjusts, the other foot steps forward, and balance returns. But as we grow older, that correction can become slower. The muscles may not respond with the same speed. The ankles may become less flexible. The feet may not sense the floor as clearly. The hips and legs may be weaker, and the nervous system may need more time to organize a safe response. This does not mean that falling is inevitable. It means that balance is an ability that deserves regular attention, just like strength, mobility, and heart health. Many older adults begin changing their lives after one frightening stumble. They stop walking outside alone. They avoid stairs. They hold on to furniture as they move through the house. They hesitate before standing up from a chair. Little by little, the fear of falling begins to reduce movement. And reduced movement makes the legs weaker and balance less reliable. It can become a difficult cycle. The good news is that the body can still improve at 70, 80, and beyond. Muscles can become stronger. Coordination can become sharper. The feet and ankles can become more responsive. Confidence can return through careful and consistent practice. Today, I want to guide you through 6 simple movements that can help train the parts of your body involved in balance. These exercises are designed to reflect the situations in which falls often happen, such as shifting your weight, stepping sideways, lifting a foot over an obstacle, walking through a narrow space, reaching in different directions, and standing up from a chair. Before you begin, safety must come first. If you have fallen recently, feel dizzy when standing, have severe osteoporosis, advanced arthritis, Parkinson's disease, significant numbness in your feet, a neurological condition, or a diagnosed balance disorder, speak with your doctor or a physical therapist before trying a new routine. If you regularly feel as though you may faint, or if your balance has suddenly become worse, that should be medically evaluated. Practice near a sturdy kitchen counter, a wall, or a strong chair that does not move and does not have wheels. Clear the area around you. Remove loose rugs, electrical cords, small tables, or anything that could get in the way. Wear secure shoes with a non-slip sole unless a healthcare professional has advised you otherwise. If you have diabetes, poor circulation, reduced sensation in your feet, or any foot wound, do not exercise barefoot without medical guidance. If any movement causes sharp pain, dizziness, chest discomfort, blurred vision, unusual shortness of breath, or a feeling that you may lose consciousness, stop immediately. Balance exercises should feel challenging enough to make you concentrate, but never so difficult that you feel unsafe. The first movement is a controlled forward lean. Stand facing a kitchen counter or the corner of a room. Keep your feet about hip-width apart and your knees relaxed. Stand tall with your chest lifted, your chin level, and your eyes looking forward. Now slowly allow your whole body to move forward from the ankles. Try not to bend sharply at the waist. Imagine that your body is one straight line moving gently forward. As your weight shifts, you may feel more pressure under the front of your feet and through your toes. Move only a small distance. Before you feel the need to take a step, press your feet into the floor and return to your upright position. That is 1 repetition. Begin with 5 slow repetitions. Rest, and repeat another set only if you still feel steady. The purpose is not to see how far you can lean. The purpose is to teach your body to recognize that your weight is moving forward and then bring you safely back to the center. This type of control is important when you reach for something, begin walking, or accidentally tip forward. The second movement trains side-to-side control. Stand behind a sturdy chair and place both hands lightly on the back. Keep your feet about hip-width apart. Slowly shift your weight toward your right foot. Keep your chest upright and avoid throwing your shoulders to the side. As more of your weight moves onto the right leg, allow the left heel to become light. You may lift the left foot slightly from the floor, but only if you feel secure. Hold for 2 seconds, then return to the center. Now shift your weight toward the left foot. Allow the right foot to become light. Hold again, then return to the center. Continue moving slowly from one side to the other. Begin with 6 repetitions on each side. This movement may look simple, but it trains an important skill. Every time you take a step, turn, move around furniture, or get out of a car, your body has to transfer weight from one leg to the other. If that transfer is rushed or poorly controlled, balance can be lost. As the exercise becomes easier, gradually reduce the amount of pressure through your hands. You might move from holding with both hands to one hand, then to one or to fingertips. There is no need to remove support completely. The safest version is always the correct version for you. The third movement is a supported heel-to-toe walk. Find a clear hallway or stand beside a long kitchen counter. Place one hand on the wall or counter, step forward with your right foot and place the heel close to the toes of your left foot. The feet do not need to touch. Then bring the left foot forward and place its heel close to the toes of the right foot. Continue walking slowly in a straight line. Begin with 5 to 8 steps. Stop, turn carefully using several small steps, and walk back. At first, you may want to look directly at your feet. That is understandable. However, when you feel safe, try to bring your eyes forward. In everyday life, your balance must work while you are looking toward the room, the sidewalk, or the direction you are going. If placing one foot directly in front of the other feels too difficult, widen your steps. Imagine walking along a narrow path rather than a perfectly straight line. As your control improves, the path can gradually become narrower. Do not force your feet into a position that makes you feel unstable. A wider step performed with control is far more useful than a perfect heel-to-toe step performed with fear. The fourth movement is a slow standing march. Stand behind your chair with both hands resting lightly on it. Keep your body tall. Slowly lift your right knee. Raise it only as high as you can without leaning backward or twisting your body. Hold for 1 or 2 seconds. Then lower the foot slowly and place it gently on the floor. Now repeat with the left leg. Continue alternating sides. Begin with 6 to 10 repetitions on each leg. This movement helps train the muscles that lift the foot during walking. That matters because many trips happen when the foot does not rise high enough to clear a rug, a doorstep, a crack in the pavement, or another small obstacle. Pay close attention to the way you lower the foot. Do not let it drop heavily. The controlled return to the floor is just as important as lifting the knee. It trains your body to place the foot accurately and stabilize your weight as you step. When the movement becomes easier, you may reduce your hand support. You can also allow the opposite arm to move naturally, similar to normal walking. Continue moving slowly. This is a coordination exercise, not a speed exercise. The fifth movement trains balance in several directions. Stand beside a sturdy chair and hold it with your right hand. Keep your right foot planted and your right knee slightly relaxed. Move your left foot forward and lightly touch the floor with your toes. Bring it back to the starting position. Then move the left foot out to the side. Touch the floor and return. Finally, move the left foot slightly backward and diagonally. Touch the floor and return again. Repeat this sequence 3 times. Then turn around, hold the chair with your left hand, and perform the same movements with your right foot. Keep each step small. Your standing leg should remain steady, but do not lock the knee. Keep your chest upright and avoid making sudden movements. This exercise reflects the way we actually move during the day. We rarely travel in one direction only. We step forward toward a counter, sideways around a table, or backward while opening a door. We reach, turn, and adjust our feet constantly. Practicing these directions in a controlled way helps the ankles, hips, and nervous system work together. The sixth movement is one of the most practical exercises you can perform. It is the controlled chair rise. Choose a firm chair that does not slide. Place it against a wall if necessary. Sit near the front half of the seat. Place both feet flat on the floor, about hip width apart. Bring your feet slightly behind your knees if that position feels comfortable. Lean your upper body forward from the hips. Think of bringing your nose over your toes. Press your feet into the floor and slowly stand up. Once you are fully upright, pause for 2 seconds and make sure you feel stable. Then move your hips backward, bend your knees, and lower yourself slowly to the chair. Do not drop into the seat. Begin with 5 repetitions. If you cannot stand without using your hands, use the armrests or place your hands on your thighs. There is nothing wrong with using assistance. The goal is not to prove that you can stand without support. The goal is to practice the movement safely and gradually build strength. Over time, you may notice that you need less pressure from your hands. You might first push firmly, then use lighter pressure, and eventually use only your fingertips. Progress can take several weeks. That is normal. Standing up from a chair requires more than leg strength. It also requires the body to shift forward, organize the feet, straighten the hips and knees, and stabilize one standing. That is why this exercise is so valuable for daily independence. You do not need to perform all 6 movements at once. A better approach is to begin with 2 exercises and allow your body to become familiar with them. Start with the controlled forward lean and the side-to-side weight shift. Practice them for several days near a stable surface. Once those movements feel comfortable, add the slow standing march. Later, include the heel-to-toe walk. Then add the multi-directional step and the chair rise. You may add 1 exercise each week, or move more slowly if needed. There is no prize for progressing quickly. Safe and steady practice is what produces lasting improvement. You can also divide these movements throughout your day. You might practice several weight shifts while standing at the kitchen counter. You could perform 5 chair rises before lunch. You might do a few standing marches while waiting for the kettle. A short heel-to-toe walk can be practiced along the hallway once in the morning and again later in the day. These small sessions are often easier to maintain than one long workout. They also allow your nervous system to practice balance repeatedly throughout the day. Consistency is more important than intensity. 5 careful repetitions performed regularly are more valuable than 20 rushed repetitions performed once. It is also important to remember that exercise is only one part of reducing fall risk. Look carefully at your home. Loose rugs, poor lighting, slippery bathroom floors, low furniture, and electrical cords can all create unnecessary danger. Frequently used objects should be easy to reach. Hallways and stairs should be well lit, especially at night. Grab bars and non-slip surfaces may be helpful in bathrooms. Your shoes matter as well. Shoes that are loose, worn down, overly soft, or slippery may reduce stability. A secure shoe with a firm heel and a non-slip sole is usually a safer choice. Regular vision checks are important because even a small change in depth perception can affect the way you judge steps and uneven surfaces. Medication reviews also matter. Some medicines can contribute to dizziness, sleepiness, low blood pressure, or slower reaction time, especially when several medications are taken together. If you have begun holding onto furniture, avoiding stairs, reducing your walks, or feeling unsteady when you first stand up, do not assume that this is simply part of getting older. Speak with your healthcare provider. Balance problems can come from many different causes, including muscle weakness, blood pressure changes, vision problems, inner ear conditions, joint stiffness, reduced nerve sensation, or medication side effects. Identifying the cause can make treatment much more effective. Balance and strength must also work together. Balance allows the body to recognize that it is moving outside a safe position. Strength gives the body the power to correct that movement. When the legs and hips are weak, the nervous system may detect a loss of balance, but the muscles may not respond quickly or strongly enough. Stronger legs make it easier to stand, walk, climb steps, and recover after a stumble. The chair rise exercise begins to build that strength, but some people may benefit from a more complete program for the calves, thighs, hips, and trunk. A physical therapist can design a routine based on your current level and any medical conditions you may have. Walking is valuable for endurance, circulation, and confidence, but walking alone may not strengthen every muscle involved in balance. Specific strength and balance exercises may still be needed. The most important thing to understand is that your age does not remove your ability to improve. The changes may be gradual. You may not feel dramatically different after one day or even 1 week, but over time, you may notice that standing feels easier. You may reach for the wall less often. You may feel more comfortable turning in the kitchen or walking to the mailbox. You may rise from your chair with less effort. These are not small achievements. There are signs that your body is becoming more capable and that you are protecting your independence. A safer and steadier life is not created by one perfect exercise. It is created through regular movement, stronger muscles, a safer home, appropriate medical care, and small habits repeated over time. Begin with the level that feels safe today. Use support whenever you need it. Move slowly and pay attention to how your body responds. The purpose of balance training is not simply to avoid falling. It is to help you continue walking through your own home, stepping outside, visiting the people you care about, and living your daily life with greater freedom and confidence.